If you've heard the word shock used in a medical context and you don't know what it means or it doesn't make sense, then this is for you. Your heart sends blood first to your lungs and then to your brain and the rest of your organs. Shock is defined as not enough perfusion of blood to meet the demands of brain or organs. And there are 4 reasons why you might be having this problem. Number 1, there might not be enough blood. There might not be enough fluid in the system to supply the brain and organs with enough oxygen and fuel. So this might be seen in bleeding or in severe dehydration. There's just not enough fluid in the system. So that patient either needs more fluid or more blood. Option number 2 is there's a blockage. If we think in terms of simple plumbing, if you've got fluid, pipes, a pump, and an end organ, and the end organ's not being supplied, the problem might be a blockage in one of the pipes, such as a pulmonary embolism or a clot like a stroke. You need to get rid of the blockage. So you can either give clot-busting drugs, like thrombolysis, or you can do a physical procedure and remove that blockage. Option number 3 is the pipes are leaking or the blood is being redistributed to the wrong bits of the body, like the skin, when you want it to be going to the brain and the main organs. We see this in sepsis, we see this in anaphylaxis, and it's called distributive shock. So the blood vessels all relax, the blood pressure drops because there's no resistance for the heart to pump against. These people don't necessarily need lots of fluid, they need vasopressors, which literally mean blood vessel squeezers. What that means is squeeze those blood vessels, increase the pressure, and return the blood back to those important organs. And finally, we have cardiogenic shock. So this is simply your heart is not pumping properly. And now this might be for a number of reasons. Classically, it's a heart attack or heart failure, but in this instance, you might consider inotropes. These are drugs that make the heart contract harder. You don't want to give loads more fluid because they're already fluid overloaded. You don't want to increase the resistance with vasopressors because you're just going to give the heart more work to do. What you want is the heart to contract more firmly, and that's what inotropes are for. So that's a really simple overview of shock. We've got hypovolemic shock, we've got obstructive shock, we've got distributive shock, and cardiogenic shock. And if you think about it in terms of simple plumbing, you've got a pump, you've got pipes, you've got an end organ you need to supply, you've got fluid, and you could potentially have a blockage somewhere. It makes the whole system a bit easier to understand.